all about first aid. Let's get to know more about first aid.
Let us start by giving the definition of first aid. What is first aid? First aid is the provision of initial care for an illness or injury. It is usually performed by a layperson to a sick or injured patient until definitive medical treatment can be accessed. Additional definitions of first aid. According to Canadian Centre for Occupational Health and Safety, first aid is an emergency care given immediately to an injured person. Moreover, according to the website of St. John Ambulance, first aid is the help given to someone who is injured or ill to keep them safe and to cause no further harm.
Here are the 3 objectives of first aid. Preserve life. Saving the lives is the main aim of first aid. It can be done by carrying out emergency first aid procedures such as opening a casualty's airway or performing cardiopulmonary resuscitation or CPR. But remember, if a situation is too dangerous to approach, you should stay back and better wait for professional help. Next is to prevent further harm. The patient must be kept stable and their condition must not worsen before the emergency personnel arrive. In this stage, the responsibility of the responder is to include placing the casualty in a comfortable and safe position, providing comfort and removing any dangers. Lastly is promoting recovery. It may include things such as applying a bandage to a wound or things like encouraging the patient if conscious and any attempt to relieve pain and take steps that may help in the recovery process. In addition, simple first aid can significantly affect the long-term recovery of an injury. Doing first aid certainly have a number of responsibilities during emergencies, but remembering the 3 P's of first aid will help them to prioritize things that are important for the casualty.
What is the importance of first aid? Number 1, it helps to save lives. Number 2, it provides comfort to victims. Number 3, it prevents situations from becoming worse. Number 4, it encourages healthy and safe living.
Characteristics of good first aider. Being a first aider is a big responsibility. That is why we will discuss the 6 characteristics that a good first aider must have. First is, they must be gentle. A good first aider must know how to handle and take good care of the victim. Second is, they must be resourceful. They should have the supplies needed for them to immediately treat the victim, and also make the best out of the supplies they have on hand. The third is being observant. A first aider should be aware of the situation happened and observe the surrounding in which the accident happened. Fourth, a good first aider must be tactful. They must handle the situation in a calm manner to avoid the panic of the victim. Empathic. A good first aider must be comforting in order for the victim to trust on what they are doing. Lastly is respectable. When executing the first aid to the victim, the first aider must be professional even if the victim is panicking. If a first aider possesses all these characteristics, they are capable to be a good first aider.
There are golden rules in giving emergency care. 1. Obtain consent when possible. 2. Do think for the worst. 3. Call or send for help. 4. Identify yourself to the victim. 5. Respect victim modesty and physical privacy. 6. Be calm and as direct as possible. 7. Care for the most serious injuries first. And 8. Assist the victim with his or her prescribed medication. If you find yourself in an emergency situation, follow these safe steps. In the case of a burn, cool the affected area with cool running water as soon as possible for a minimum of 10 minutes. This will reduce the pain, swelling, and risk of scarring. Do not use ice or ice water. Next, cover the wound in cling film or plastic bag to reduce pain. Do not burst any blister. If the burn is severe, immediately call the emergency services. If you find yourself in the right place at the right time, be prepared to save a life and follow these safe steps. First, cool affected area. Second, cover in cling film or plastic bag. And last, seek medical attention.